going here. Hello, everybody. Welcome to another Zoom call. We have a number of questions that came in, and we do have to address, if you are on TrueRife's email list, the critical update of version 6.4. Touched on it last week, but have more details this week and more details on your member site. So make sure you use your member site for announcements. You'll see some information on there that you'll want to utilize or hear from people. We literally hear from people every week that haven't been on the member site for even a year. It's like, well, I don't know. I don't understand. So please use the member site. Please, if you want a coaching call, you can pay for the coaching call on the member site. You can fill out this request form on the member site as well. Really important. That keeps us protected, and it saves us time on that coaching call because I know what you want to talk about. So fill that out on the member site, that coaching call request form. Please do that. You have access to all the courses and the blogs. And now let's talk about the TrueRife update. I've created a video. I can't play here because I just embedded the picture, but you can look at it on the member site. It's on the home page and on the Rife page of the member site. So look at that video about the TrueRife software update to help you understand whether you need to do that or not. Also created a data on there in written form. So it says, do not update the TrueRife program to 6.4 until you watch the above video. That's this video that I created. So please watch that video. If you do or already did update to 6.4, you will not see your personal programs. So if you update to program 6.4 software, your personal programs go bye-bye. So you don't want to do that without being careful in doing some other steps first. And these are the other steps. You have to make sure that you have saved your program before the update. But if you already did the update and your programs are gone, okay, well then you're going to have to either send your computer back to us, or if you feel like you're really computer savvy, we could send your program on a flash drive and you could follow these instructions. I'm not going to go over them here. They're on the member site, on 2 pages on the member site, the home page of the member site, and on the Rife page. They're also on the Rife frequency course on so you could look at them there. This walks you through what I have to do if you send your computer back to me, and if you already updated to 6.4. So go ahead and look at those with 6.4, even with 6.1, 6.2, which not very many of you have, but with anything over 6.0, which 99% of you have, you have 2 extra clicks. It's just 2 extra clicks. It's not that big a deal. It is 2 extra clicks, and that's not going to go away anytime soon. You have to follow 2 extra things. You have to open up the open program of your TrueRife. Then you have to go to documents on the left-hand side. And in documents, you'll see a folder that says TrueRife frequencies that either you or I created. And in there, you'll see your personal program. And if you're still running 6.0, you're wondering what in the world I'm talking about, well, you have to watch this video to understand that. So no more time on that. Questions. Most of my life, I've had dry skin on my hands. If I didn't use lotion often enough, I would have stabbing pain in addition to the dryness. Now I have itchy, dry skin with stabbing pain all over my body that has been torturing me for 3 months. In a telephone conversation about a month ago, I think you mentioned that itching was common with lymphomas. I don't want to take the pharmaceutical medications to treat it. I've tried multiple lotions and natural remedies. 100% coconut oil is the only thing that brings some relief when applied, but it doesn't do enough. My pain, discomfort is constantly a 6 out of 10 and goes as high as 9 out of 10. in my worst moments when my body temperature changes. Do you know of anything safe for my body that can help my pain? Also, the flavor of the food is not the same as the aroma I'm smelling. This seems so strange to me. I'm taking at least 50 micrograms of zinc daily for weeks without noticing any improvement. Any thoughts on how to remedy this? Well, there's a couple possibilities that are going on with this flavor in the food thing, and I have to do a little bit more investigation to answer that question. As far as the itchiness and the dry skin that you've had most of your life, I'm sure if you already were prone to that for reasons that I'll have to think about for a few minutes here, and then you end up with lymphoma on top of that, which quite often can cause that, it's exasperated the symptoms that even most lymphoma patients would have. I'm sorry for that. As far as dealing with the original, now if a person just called and said, I just have dry skin, what can you do about it? It's really an internal problem. It's not an external problem. It is not, yes, it can be caused from external things. Let's say you're using chemicals on your skin because you wash parts in a part cleaner because you're a mechanic or something and you don't use gloves and you're getting chemicals and damaging your skin, and that's what's causing dry skin. But when you have dry skin, typically without any exposure to exogenous sources of that would damage your skin and your external epithelial cells, you think of internal things. So it quite often has to do with an inability to break down fatty acids. And that's common, more common than you think. That has to do with issues with dermatitis and such like that too. They have a lack of ability to break down fatty acids, and fatty acids are necessary to lubricate your dermis layers. So doing things topically can be helpful as far as like what you're saying. You're using coconut oil. I would also think of some lard-based creams that might be helpful for you. But you do want to address it internally, like trying a high DHA, EPA, trying some good different variety of fish oil supplements. I would try that as well. So I have to think about this a little bit. We might want to have a conversation about this. I said did blood work, 2 liver enzymes went down. So that's a good sign. But the alkaline phosphate went up a lot. So let's think about that a little bit. So elevated liver enzymes almost invariably speak to damage to the liver via toxin exposure or metastasis to the liver. Alkaline phosphatase is considered a liver enzyme, but it also will elevate. So it'll elevate if there's damage to the liver, but it will also go up if there's metastasis to the bone, which your other liver enzymes won't. So if you have normal liver enzymes but elevated alkaline phosphatase, then you think of, is there metastasis to the bone? So in this case, if your liver enzymes went down, that means we're detoxing much better. If your alkaline phos went up, that just is an indication of what we already know in this person's case, is that there's metastasis to the bone. Doesn't mean that there's more metastasis per se, but that's why it's going up. Trying to do as many coffee enemas as possible a day, and that's what's probably helping detox the liver and helping with the cough, with the liver enzymes, castor oil packs, along with everything else. Started radiation on Monday on rib. Any ideas? I did start the Helleborus mistletoe last week, just half the dose. So understand there's the two different types of mistletoe that is used in mistletoe therapy. The Helleborus is the second type that can be very beneficial if a person's doing radiation. So I'm glad that your doctor is doing well with that protocol. I'm not sure if the alkaline phos went up after the radiation or not. It's going to be interesting to see how radiation therapy changes the alkaline phosphatase levels. I have a few questions. Can I go to the dentist and get treatment healthily? Is it dangerous? I know I have cavities and possibly root canals needed. So first of all, I wouldn't get any root canals personally. You know, it's hard to do that when if it's a front tooth or something like that. But you know, there's just dangers in getting root canals. I think I have some articles on the blog post, so you can certainly Google lots of dangers in root canal articles out there by good biological dentists. If a person, if you're fairly healthy, you know, you're not like, you know, super sick with your cancer, certainly you should go to the dentist and you should get your teeth, you know, cared for. You should go try your best to go to a biological dentist who will not even recommend root canals though. So find a biological dentist in your area would be my first choice, because you want to get proper dentistry, not just regular dentistry. Can I take soursop leaves to boil to make tea? I don't know the answer to that, honestly. I don't know. I've not ever done that. I've not had anybody do that, not anybody tell me that they were doing that. So I do not know the answer to that. Heard it's really good at getting rid of cancer. Yeah, I wish I'll do some investigation on that, but I don't know. Can I, yeah, or is this pushing it for me? No, yams has a very low glycemic index, so you'd be fine eating some yams. That would be fine. That would be a good source of some calories. I've been able to get a supply of ivermectin. What would you suggest for dosing and how long for prostate cancer? Excuse me. Well, ivermectin is a prescription drug, so I can't give you too much details on that, except that there's a lot of data out there that they have been covering up since COVID stuff about the benefits of ivermectin for cancer. So as far as what I have read, at least, I haven't seen any negatives really. There isn't really any downsides to that. So I don't see any downsides to doing it. I would certainly try it if it was me. So I would give it a try for sure. I was not expecting blood work done today after radiation. I think they will do weekly blood work since the chemo pill raises glucose levels. My alkaline phos keeps going up. I've been on this chemo pill for 10 days. This pill makes me so hungry, I could eat anything in sight. Yet I am swelling up and I can't eat much at a time. I'm trying to fast, but I wake up so hungry at night. Seeing a new oncologist tomorrow. Not sure what she will say about the edema. Thought maybe the Helleborus mistletoe might help. Yeah, I'm excited to hear if you see that this helps. We've had some other people that have used that while they were doing radiation with some good success. So. From my last cheek swab, you suggested a mycotox test. So the mycotox test is the name of the test from Mosaic Laboratories, used to be Great Plains Laboratories, and a test for glyphosate. So Mosaic has a good glyphosate test too. I like those two tests. Would it be better to get the Vibrant America Total Tox Burden Organic Acid PFAs test for more overall information? There's pros, personally, there's pros and cons to the organic acid test. To me, I think the negative to the organic acid test is I think the information that's gleaned from that changes on a daily basis. So I think this is a less beneficial test. I know there's a lot of functional doctors that hang their hat on organic acid testing, but I'm not one of them. I don't think it's a super valuable test. The total tox burden, I'm not sure about Vibrance America's total tox burden test. So sure, we've had people get other tests. You want to get that test, you can do that for sure. We'll look at that. My tissue pathology from my double mastectomy came back with metastasis to my left sentinel node and 2 of 5 other nodes on the left. My surgeon took what she thought was one node we clipped pre-surgery, but it was clumped together. She wants me to consult with the oncologist, see if the nodes need to be removed or if we do radiation. I'm supposed to consult with the radiologist tomorrow and a new oncologist on Monday. I keep reading negative things about radiation. Plus, the plastic surgeon said radiated skin causes complications with implants, which I plan on right now. I will consult with you one-on-one after I gather some more information. But can you think of anything I should be considering and asking these docs as I gather information? Well, as you know, in other conversations that we've had in the Zoom calls, I'm not a huge fan of soft tissue radiation unless it can be really targeted. So yeah, I would say wait until you have another conversation with the oncologists and then we could talk. If you didn't recommend any after surgery supplements when you did my cheek swab, does that mean I didn't need any extra healing? The answer is that's correct. So let me finish the question here because they did a nipple graft and it seems to be healing okay, but one side is not as good as the other. I have a bit of Garden of Life grass-fed collagen peptides, but it has 1900 milligrams of glutamic acid per 20 gram scoop. So I didn't know if that'd be good or not, or is there something else I could use? So a lot of the supplements that a person would take to try to heal faster after a surgery are supplements that are going to stimulate cell growth. That's why it helps you heal faster after a surgery. So is it wise for a cancer patient to be taking a bunch of supplements that will stimulate cell growth? Well, that's a question you have to ask yourself, but my book, it's probably not the wisest thing to do. So that's why I don't typically recommend taking after surgery supplements to help a person heal, unless it's a surgery that the person doesn't have a diagnosis of cancer. So I would not recommend this product, and I wouldn't recommend taking other products to help you heal faster. I got a rash on day 8 post chemo and still have it now on day 13. It's very itchy and sore and covers 90% of me. Oh my goodness. Are you familiar with rashes from chemo? So yes, it's very common to get rashes from chemo. They have different syndromes that they've called it. Hand and foot disease or something like that, because your body is you're detoxing and you get a reaction. So there's different thoughts to why you get rashes after chemo. Is it your body detoxing through the skin and that's causing the rash? Is it because you're basically having an allergic histamine type reaction to the chemo? That's a possibility. So number one, is there something I could have done to prevent it? Not really, no. Did I detox? Not enough, or maybe too much. Herxheimer reaction. And the answer is no, that's not a Herxheimer reaction. So a Herxheimer reaction is a reaction to cell death where you have endotoxins and you're reacting to endotoxins, typically lipopolysaccharides. That's not what it is. But did I not detox enough Well, again, you don't have full control over your ability to detox. You're just trying to support your detox pathways. That's why after your 48 hours, when you try to get the chemo out of you, you're doing coffee enemas, you're doing castor oil packs, you're doing, you're supporting your liver detox pathways with different supplements. You do everything you possibly can. It doesn't mean that you're gonna, triple your detox pathway, the rate of detoxification by doing X, Y, and Z. There's no way that you can physically measure those things. You see the outcomes of or lack or ability or disability in detoxifying. And in this case, this would be one of them, but you don't, you just do your best you possibly can. There's no magic thing that's going to make this all go away. So you just continue to do the best thing you possibly can. Increase your ion pro waves to a daily. Increase your coffee enemas. If you ask this question of Max Gerson 50 years ago, he'd say you should be doing 5 coffee enemas a day if you're really seeing an inability to detoxify. So everybody has a different rate of detoxification that is often is almost always beyond your control. So you just try to do your best to help stimulate that. So increase the number of coffee enemas would be a big thing to do. I think that answers that question. Okay, the questions that came in. I got iliac biopsy back saying progressive high-grade follicular lymphoma. I am on my second 21 days with artemisinin. Any thoughts to get this under control? No, I think we just did, if I remember correctly, we just did a new cheek swab on you not very long ago when you started on that artemisinin protocol. I don't know when the last cheek swab is. If it was over 30 days ago, we could do another cheek swab and reassess some of those things, and reassess your right frequency. So you might want to send another cheek swab in. I'm having a problem with my Rife machine. The Ion Pro Wave works, no problem, but the bulb is totally dead and does not light at all. Okay, I called Rife and they want me to send in the bulb and the Rife machine. Have you seen this happen? How long do you think it'll take to get my Rife back? So if the bulb is totally dead and it won't light at all, you could have just a problem with the bulb. I don't know enough about the internal components that to know if the bulb programs would not work if the Ion Pro Wave. It seems like if the Ion Pro Wave's working, it's not the machine. It would be the bulb. That's my thought. But we've had people have problems with the bulb. Typically, it has to do with like they tripped over the cord or something like that and pulled the cord out at the glass, tube itself, or the solder broke, and then the bulb's not going to work. So you're not getting any frequencies. For when we first started with TrueRife, 12, 15 years ago, we had different issues that were corrected and it never happened again. That's probably the possibility. I would definitely send it in as fast as possible. Typically, they'll fix it, that same day or the next day and send it back to you. So it's usually a pretty quick turnaround. They've been really good about that, even with under new management. They've been really good about that. Dr. Connors, what do you know about C60 for mitochondrial health? I have heard that it raises hormone levels. Is it safe for breast cancer? It does seem that when I take your greens first, my tumor bleeds more. Does it cause the blood to be thinner? So the answer to this one first, the greens first can cause it because it does have a lot of different herbs in it. So if that's the case, I would just stop that greens first or just cut your dose right down. The C60, I'm not a super big fan on increasing mitochondrial function with cancer patients because you could also increase the mitochondrial function of the cancer cell itself. And you don't, so the mitochondria is where your is the organelle within the cell that you make energy. That's the main function of the mitochondria. It also has some DNA components in it, but the main function of the mitochondria, as we know it today, is to make ATP, and ATP is what runs the cell, and it runs all your cells. And increasing mitochondrial health in cancer patients is often frowned upon in the alternative community because you are, also increasing mitochondrial health in cancer cells. That's at least one line of thought. Remember, with dealing with cancer, there's often multiple lines of thought. Just like, my line of thought is not to use a lot of high amounts of glutamine when you have cancer, because, like questioned earlier, because it could increase growth. That's the whole idea of glutamine. But there's other alternative doctors that do that use glutamine. It's just, you have to, do your best research and kind of trust your gut on some of these things too. But I've studied C60 a number of years ago when it first came out. There's a book, had some information about it. I got the book. I just felt like that was the right thing to do with cancer. Can we use our Rife programming without upgrading to 6.2 or 6.4? What is the benefit? Yes, please watch that video. That will answer that question. With my last cheek swab, you added a number of supplements to my list. After I take them, I often get blurry eyes and sometimes a headache. Any suggestions? I am doing liver pack every day too. I would say make sure, number one, you're taking these with food and maybe try to break them up a little bit more. It also concerns me when a person says they have a reaction to a supplement that there is not at least the possibility that the reaction is not to the supplement, but to the capsule. So if you would try to open the capsules, I can't remember what I added to your list, but if you try to open the capsules, if they are capsules, and do away with the capsule and just put that into a shake or something, sprinkle it on your food, something like that. Try that and see if that makes a difference. There is it's not a uncommon thing that people can have a sensitivity to the components of the capsule, nor is it an uncommon thing that people can actually have antibodies to the gelatins that can be in capsules, even natural capsules like the ones we have. People from Puerto Rico and other Caribbean islands do boil soursop leaves to make some tea. It's worth. I have heard that. Thank you for that. What are your thoughts about oxalates? Are oxalates harmful? Well, oxalates are a bigger problem if you have a lot of defects on your oxalate detoxification gene. So people that have a lot of defects on that, oxalates become a bigger problem. Can't get rid of them. They can form stones and cause kidney stones and other stones. But even someone who doesn't have any issues on there, remember, your genes are just a picture. They're just a photograph of possibilities. So a person, let's say, have 0 defects, single or double allele gene defects on every single oxalate gene. They're perfectly clean. And they could get a kidney stone. Why is that? Because it doesn't mean just because you don't have defects that you still don't have issues with detoxifying not just oxalates, but other things. So if you don't detoxify oxalates very well, they can build up in your kidneys and they can cause stones in other places too. So oxalates can be an issue, but it's like everything with moderation. So with some people though, especially people that have defects, they can be highly sensitive to oxalates and notice ill health when they consume foods with a greater amount of oxalates. So again, just gotta test yourself. Boy, do I feel worse when I eat rhubarb? Yes, I do. Okay, well, maybe you have oxalate issues. No, I don't at all. Well, maybe you don't have oxalate issues. Even if you do have defects, maybe you're detoxing them very well. Remember, detoxification is a fluid flow of this river going through you. It doesn't mean that just because I have detox issues today that I might not have them tomorrow. It's constantly flowing. This river is flowing. So you're doing everything you can to keep this river moving at a rate that's acceptable to get rid of poisons that you're exposed to, even things that are in foods that are good for us. So you just keep working on that river to get things out of your body that you don't want. What do you think about low dose chemotherapy? Well, low dose chemotherapy can be very beneficial for people, especially if they're sensitive to higher dose chemotherapy. You know, some people go through regular chemotherapy and don't have a lot of issues. Some people just have a lot of issues, and the people that do have a lot of issues with chemotherapy usually are people that just have, you know, issues with their detoxification. They just don't detoxify very well, no matter what it is. So then using low dose chemotherapy can be better, but it has its negative things too. So, you know, low dose chemotherapy, typically if you use a lot more dosage, meaning not as you get 10% of the dose of regular chemotherapy usually, but you have to take more of the doses themselves. Another negative is that you typically have to move to wherever you can get the application, because you're there for 3 to 6 months going through the therapy. So it's not like you can fly in and out, you know, on a regular basis to do it. That can be a negative as far as lifestyle issues. And then it's still chemotherapy. So if the chemotherapy isn't really going to work for your cancer, then the low dose chemotherapy isn't going to work for your cancer either. And there's only a percentage of people that chemotherapy is even going to work for your cancer. So, I mean, if regular chemotherapy is not going to work for me, then low dose chemotherapy is not going to work for me either. So, what do you think about the work of Natasha Winters? I think this is the work of care oncology type things. If I remember correctly, she's the one who wrote the book of Starving Your Cancer and uses different drugs, off-label drugs. So she's all into off-label drugs. We have some people that are doing that, if I'm correct there. Sorry if I'm not. We have some people that are doing off-label drugs to help with their cancer. Metformin, to me, makes maybe the most sense because you're really reducing your glucose levels. But I know she recommends doxycycline, and she's, you know, if this is the same person, I really like her because she takes a very rational approach to it, meaning that she's not making claims that aren't really that aren't honest. So I appreciate that. So we have a lot of people that are doing some of those things and think that they're really helping them. So Zoom blanked out while you're answering my question about that rash. Would you mind? Well, if you could just listen to this again, I'd appreciate that. I noticed the Cleartox has lumbrokinase in it. Am I supposed to take that 3 per day on an empty stomach? If I didn't tell you to put it on, you don't have to, if you're asking if you have to take lumbrokinase on an empty stomach, the answer is no. And do you have to, if I told you to take Cleartox on an empty stomach, then the answer is yes. So, but a person does not, if you're taking lumbrokinase by itself, you don't have to take that on an empty stomach. Does the effect of Keytruda immunotherapy on the immune system wear off or stop after time on its own? That's a good question. And the answer is yes, almost always, at least what we've seen. So the negative effects of immunotherapy can lead to inflammatory responses in the body, and it does wear off over time. So immunotherapy only has, you know, it's like anything in your body, you are detoxing. It has a half-life in your body. It'll disappear over a period of time. That's why it's re-administered every 3 weeks. So it's it will dissipate and you'll have, it doesn't leave, it can leave lasting damage to a person, but it doesn't have that same lasting effect. It doesn't block the receptor site on T cells, because that's what immunotherapy does. It doesn't do that forever. So yes. I feel very dried out inside and out. I drink about 3 quarts of water a day. Should I be taking something different to lubricate my body? Well, fats can be helpful for that. Getting good fats, that can be helpful for that dried out feeling. That can be helpful for the skin issues that we talked about. Increasing good fats, tallow type fats, which are animal fats, which I know are, bad things in today's society, but, our ancestors, ate, lard on a regular basis. And, there's people groups that eat that on a regular basis and eat whale blubber as their main source of food and live long and happy lives. So it is not fat that's causing arterial sclerosis. And so increasing good fats might be helpful in different types of good fats. I have a section on parent oils in my book, but getting some good omega-3 fats would be helpful. Consuming coconut oil, consuming animal fats can be helpful. Nasha Winters is all about the metabolic approach to cancer. Oh, okay. Nasha Winters is a protege of the Siegfried, and he talks about the metabolic approach to cancer, which is the Jane McClellan book. Thank you. With How to Starve Your Cancer. Nasha Winters is the author of the Mistletoe book and the metabolic approach. Thank you. The metabolic approach, I think, is tied to Dr. Siegfried's book on the ketogenic approach to cancer. So yeah, I'm all in favor of a ketogenic approach to cancer. Is if, like we talked about so many times, is that you're not hung up on trying to get into ketosis and you're just trying to get your glucose levels down. So there's numerous studies going on right now that are showing that it's not important to get into ketosis. It's just important to try to get your glucose levels down. And again, that only really works for a percentage of people, because it's only a percentage of people that their cancer is directly 100% fed off of the glycolysis pathway and not off of glutamine. So you don't know that, and cancer is always trying to change its fuel source. So, I've had people go into full ketosis and reverse their brain cancer, and all of a sudden the brain cancer comes back with a vengeance, even though they've stayed on a fairly strong ketogenic diet. Why is that? Because the cancer is changing its fuel source. So then they have to change their diet. So you have to be willing, I think, and I preach this forever, to be pliable, to change your approach when it's not going in the right direction. It doesn't mean your last approach was wrong. It just means that cancer is constantly trying to change its fuel source. I missed a question back here. Have you heard of nicotine for long COVID? No, I don't think I have. I'm trying to think. It rings a bell, but I don't. I've written some stuff about long COVID, but I don't think I wrote anything about nicotine. If increasing mitochondrial function could also increase the function of cancer cells, I'm wondering about the efficacy of a ketogenic diet, since they're also supposed to lead to increase mitochondrial function. Yeah, maybe that's why it doesn't work for some people. It's interesting, I think. The more you learn, the more you realize how complex our body is. Or you could say, the more you learn, the more you realize just how stupid you are. I get that feeling every single day. So But in a nice way, the more you learn, the more you realize that really there's just so much information. And I think this is why I've always been saying that it's really wrong to take dogmatic stances. Um, you know, you know, again, going back to the question about the C60, or I made a statement that maybe was a little too dogmatic, that I've not been in favor of I've been being careful about um, increasing mitochondrial function for cancer patients. But the truth is that maybe if a person isn't doing well and doing C60, increasing the mitochondrial function of your healthy cells is what can knock out the cancer cells. So, if anybody is looking for me to give them the magic answers, I think the more you go listen to these Zoom calls, you realize that I nor does anyone have the magic answers. And I think, and I hope that you're realizing when you read books about written by doctors that are basically kind of egotistically professing that they have magic answers, probably haven't seen a lot of cancer patients. Because it's one of the things I remember learning from Dr. Gonzalez, who I just respected so highly, is that he never pretended to have that. And he was just always open-minded. And, you know, and because he was working so hard on trying to help cancer patients, and that's all he saw in his practice was cancer patients. Matter of fact, he was still alive when Siegfried came out with his book on the metabolic approach to cancer. And his critique of it to me was that it's interesting that this scientist is saying that everybody with cancer should go on a ketogenic diet, when this scientist, he only literally, if you go back and read his book, he has the example of one cancer patient in the book, with the person had smoldering multiple myeloma, which smoldering multiple myeloma, can smolder for 10 years. You can't use that as your one example of a ketogenic, helping a cancer patient with a ketogenic diet. Again, this doctor who wrote the book, brilliant as he was, understanding metabolic pathways as brilliantly as he did, he doesn't treat cancer patients. So he had one example in his book. So always when you read information, when you read data, when you read books, um, you're going to get the most honest answers from practitioners who are seeing people on a daily basis that have cancer. I think if you see people on a daily basis, you realize what may work beautifully for one person doesn't work at all for another person. You have to be willing to change course and tweak things and be open-minded to as many things as possible, and not so dogmatically positioned. So, I'm open to, if you feel like God's leading you in any way, and I've said this over and over again, if God's leading you to do something, then by all means, you need to be obedient to that more than you're obedient to anything else. So I just think all of our patients are just so, you guys are studying and learning, and I learned just more from you guys than you guys do from me. I'm still pre-diabetic, even though I have given up grains. I am taking the supplements you suggest. Any other suggestions? Remember, we talked about this. Sometimes again, we don't fit into this mold of we're going to, go on a ketogenic-like diet, which you've basically been on, and have our body drop into a ketone burning state, or a ketone burning state in full ketosis. It just doesn't always work that way. So we just got to be okay with it not working that way, and our glucose staying up at 98 when I can't figure out why, because I don't eat any carbohydrates. It's just the way it is, and you can't really make that happen any more than you are. And certainly going on a fast or doing some sort of modified fast would not be in your best interest at this point. So we don't want to do that. Remember, one of the worst things you can do is put yourself in a state of cachexia where you're losing weight and you're way underweight. That's just not healthy for your healthy cells. So again, sometimes doing things that are good for your healthy cells that seemingly, well, this might help feed a cancer cell, I have to be careful, but if it's good for your healthy cells, sometimes that's the best thing for a person. So, but I'll tell you, well, like I said last week, over and over, this is one of the most important things is what goes on between your ears, your stress levels, your anxiety over your diet, over your supplements, over your cancer is the most critical factor, in my opinion. I was interviewed for something, well, it was a couple months ago, and somebody said, well, what's the most critical factor in helping somebody stop cancer? And it's just like, it just came out immediately, which was, it's what goes on in your head. So I believe in my life that, God used cancer to help change, you know, that that's my spiritual walk and what goes on in my head and my self-talk. It's so important to take that role of, you know what, I'm going to do everything I can and I'm not going to freak out about anything, including the results. And if God wants me to change something, he's just going to have to, hit me over the head sometimes. Sometimes he certainly does that. But I need to listen, and I need to be good at listening to that still small voice of the Holy Spirit in my life so he can just tell me what to do. But I'm not going to fret. I'm not going to worry. I'm not going to, because then I'm really making an idol out of my diet and my blood test and my results. And regardless, that's not God's purpose in my life. And it's not bringing me joy. And it's not, helping me fulfill any purpose and why God has me stay alive. If he's got me here alive, it's to serve others. And I'm doing no good serving others by being consumed with myself. So that's a work in progress. And that's the fight that we're called to fight, that good fight that we're called to fight is the fight against our flesh. And to make sure that we are serving God the way we're supposed to be serving him and not be too self-consumed, at least for myself. And that's a struggle. It's a struggle for a lot of us, but certainly my struggle, and it's one that we just keep fighting that fight. All right, so please watch the video on the site about the TrueRife updates. You do not have to do the updates. You can stay running your 6.0 software. There's no reason for you to do the update, but there is going to probably come a time where you're going to have to do the update. If that scares you a little bit, us do the update. Send it back to us, and we'll do the update for you. But there's certainly no reason that you have to do the 6.4 update. But if you do contact TrueRife and you're having trouble with the Rife, they're going to tell you have to do, they're not going to service anything below 6.4. So they will make you do the 6.4 update. So yeah, if you're doing well and you could do without your Rife for a couple days, well then send it back to us and we'll do the update for you. Or if you're pretty computer savvy, you can follow these handy dandy instructions that I put right on the member site, and you could do the update by yourself, and you could have this all done in 15 minutes. So it's up to you. So watch the video and that will give you some more hints. All right, that being said, know that I'm praying for all you guys, and keep up the good fight, and you will be rewarded. Know that I love you all, and we're constantly praying for all of you. Till next week. Bye-bye.